Little guinea pig, little guinea pig, let me in. What do you mean you weren't expecting me? Well, of course you weren't, silly little guinea pig. See, I was under the distinct impression that we had a little agreement. Isn't that right? Don't act coy, though it does look very nice on you. I distinctly remember that you and I signed a little contract together. I help you free of charge. I provide you with medicine and medical help whenever you need it. No questions asked. And you repay me by I'm all ears. By being what? That's right. Being my little guinea pig. So I figured I'd invite myself over, seeing as you're in tip-top shape. And we can finally fulfill my end of the bargain. What, you didn't think I was going to be that nice forever, did you? No. Don't get me wrong. I do care about you a great deal, little guinea pig. But a girl has needs, and the needs are science. So I figured I'd come over, blow your house down, little guinea pig, and take what I want, including more samples. Also, I have a new rendition of my medication that I'd like to see you take in front of me so I can see what happens before my very eyes. Do we have a deal? Wasn't a question. Do we have a deal? That's what I thought. Well, you get comfortable, and I will suit up, so to speak. Mainly put on gloves. And before I leave you, everything is good. Perfect. Be right back. Kind of a shame you haven't visited me in a while. But I guess I should be happy, seeing as you've been nice and safe. What? I'm not asking you what you've been up to. I know that's very hush-hush. But what can I say? You're just so intriguing. You and your little gang of friends. You know, I kind of miss seeing you guys on the news. So, again, let me ask. Been feeling okay? No little sniffles? No, mysterious bites? Everything looks to be in order, besides your normal lack of sleep. Sorry about that, little guinea pig. I can always prescribe something for you. Though personally, I just think maybe drinking some tea before bed might do you a world of wonders. It does for me. Did you think all I did was drink? Cute. I see how it is. Again, that's just friendly advice, not real doctor advice. Let me see. Everything looks to be okay. Let me feel your forehead really quick. Oh, sorry, not scientific enough for you. Let me go get my thermometer. Probably better so I can take it before and after. Alright, never say I don't come prepared. Okay, let me make sure it's working. You know it's old. Blah, blah, blah. Normal spiel. Apologize for the inconvenience. Come on, work for me. There it is, okay. Hold still. It's just 1, 2, 3, 4, 5. Normal, perfect. And you haven't been experiencing any headaches, bouts of dizziness, eating and drinking all right? Okay, breathing. Good. You're not lying to me, are you? Good. Alright, before we get started, now that I have you nice and fresh and healthy, let's take a blood sample. Calm now, it's only going to be a tiny little prick. Would it feel better if I told you when it was happening? Give you a little count. Count to 3, count to 5. 10. Don't be serious. Come on now. You're nice and brave. It's just going to be really quick. Good. Now I'm going to go prep the needle. And, do you need a band-aid? That's fine. I'll get you a cotton ball or something. Now, do some nice deep breaths for me. Keep yourself nice and relaxed. And only here for a moment. Alright, let's clean the area first. Do you prefer left or right? Okay. No problem, no problem. Alrighty, let me just pour some of this out. Okay. Like I said, I'll only hurt a moment. Now, put your arm out. Thank you. I do so appreciate when you follow directions so well. Little guinea pig. I knew I picked right with you. Thank you. Okay, let me just swipe, 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 swipe. It's a good thing you have such prominent veins. It makes my job so much easier. Okay. Okay. Let me go get the needle. Okay. Wouldn't it feel better if you looked away? Or maybe just close your eyes. Close your eyes. No, you're gonna be nice and brave for me. Of course you are, a little guinea pig. Now, it's just gonna be a quick little prick. Okay, tiny little prick. Counting? Yes, no. Yes, okay, on the count of 3 or count of 5? 3 or 5, 3 or 5. 5, okay. 1, 2. No, I'm not gonna do a surprise one. 3, 4, 5. Perfect. Deep breath. It'll be over in just a second. Just a second. Just a second. You're doing wonderfully. I'm not going to take too much. Knowing you, it's probably been a while since you've last eaten. And I don't want you dizzy for the medication. So just a little bit more. Just a little bit more. You're doing so good. So good. Alright, keep your arm elevated for me, and I'll be back with a little cotton ball, okay? And you're just gonna press into the area for just a tiny bit, okay? Wonderful. Alright. All I had with this giant bag. Apologies. Feels a little silly doing all of this just for one tiny little cotton ball. But when a patient needs it, I deliver. Alrighty. Why don't you press that down? Nice. Perfect. Nice pressure. And we only have to do it for a little bit, okay? Wonderful. You're so good at taking directions. It's much appreciated. See, I told you it wouldn't hurt that bad. Let's try and close this. What can I say? I know looks and, I guess notoriety can make it seem like I'm a bad doctor, but I do actually care about my patients. And I do care about you. I don't want you in unnecessary pain. Now, what the untested medication might do, well, that's anyone's guess. But just know, it's not intentional. It's a work in progress. But I'm making the medication to help others, just like yourself. Has it stopped bleeding? Perfect, okay. Let me go get the pills. You'll take one, and then we'll wait 30 minutes. And we'll go into a few tests, okay? Perfect. Alright. You ready? Do you have a glass of water? Perfect. Now, take only one. No, just one this time. This is a new strain. So go ahead. Perfect. Down the hatch. That's a wonderful little guinea pig. Now remember, 30 minutes. I'll be here just in case something terrible happens, but pretend I'm not here. Okay. Perfect. Has it been 30 minutes already? My time sure does fly. So how are you feeling? The medicine has metabolized. Good. Have you felt any dizziness? No, okay. Any headache? Okay. Dry mouth? No. Perfect. Let me take a look at your pupils real quick. Look right at me. Look right here. No redness. A little squinty, but that could just be because of the lack of sleep. Pupils look good. Okay. How about heart rate? Do you feel any racing heartbeats or any trouble swallowing, any trouble breathing? Can you give me a nice deep breath for me? You don't feel any tightness anywhere? Okay, good. So, tightness, trouble swallowing, good. Okay. Now, if you wouldn't mind, I would just like to do a few quick vision tests. How about your ears? You feel okay? You're hearing me all right? Even when I whisper, can you hear me? Still can hear me? What? Okay, I'm just teasing that last one. I didn't actually say anything. Perfect. Okay. Now for vision, just a few quick tests if you don't mind. Perfect. Alright. Okay. Can you look right at me? Perfect. Can you just look at my finger? Perfect. Now back at me. Back at my finger. Good. Okay, back at me. Can you still see my finger? Okay. Back at me. Look right at me. Good. Now what about my finger? Can you see that? No, still. Look at me. Okay, now look at the finger. Good. Okay. Now if you can just follow my finger really quick. No. You don't have to move your head just until it goes out of your vision, okay? Perfect. But you do take directions so very, very well. Continue to look at my finger. Good. Okay, again, follow my finger. Follow my finger. Good. Perfect. Okay. Now, really quick, how many fingers am I holding up? Good. Okay. And how many fingers am I holding up now? Good. Okay. How about now? 7. Good. And how about now? 6. Good. Perfect. Let's check your temperature before moving on. But positive sign about the eyes. You don't feel like you have to strain to look at me, even in this lighting. Good. Ready, just to be safe. Let's take your temperature one more time. Let's pray it's still working. Good, okay. Hold still. You know the drill. Good. 1, 2, 3, 4, 5. Okay. Good. No, it's not elevated at all. That's a positive sign. Okay. Let me just mark that down real quick. And then maybe we'll move on to, I want to test your grip strength, if you don't mind. Good. Because again, this medication is supposed to make you feel stronger, make things easier for you, both cognitively but also physically. I want to make sure that it's working as intended, or at least not worse. Okay. Alright. Let's just mark some of those things. Temperature is good. And you can see good. And the periphery is perfect. Okay, good. Alright, and still doing alright. Again, no bouts of dizziness. Perfect. Now let's move on to grip strength. Okay. And then after this, I'll have one more test for you. It's going to be easy. I'm just going, well, maybe I'll leave it a little surprise. Let's talk about grip. Alrighty. I know this silly thing. Just make sure it's nice and clean for you. One of my patients left it behind, and I figured it would probably work well for what I want. But you know, children can be sticky. It is quite fun, isn't it? Me? Never. I think I just go around playing with random toys. Well, the office can get boring sometimes. Alright, perfect. Seems relatively okay. Now, what I'm going to have you do is first start with one hand, and you're just going to squeeze it, okay? So you're going to squeeze, 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 squeeze. Okay? And then we'll do the other hand. Squeeze, squeeze, squeeze. And then we'll do both hands. So squeeze. And don't break it. I don't want to have to go out and buy another one. This thing is quite fun. Okay? Perfect. You can choose which hand you decide to start with, okay? It's no problem. Go ahead. I told you it is quite fun. Alright. So you can begin whenever you're ready. Okay, I'm gonna start with that hand. Okay, so just go ahead and squeeze for me. Good. Again. Squeeze. And release. Perfect. You don't notice any pain while doing it? No? Okay. Grip strength seems to be on par with what you're familiar with. Not any better, not any worse. It's not good. I mean, it's good for you. It's not good for me. It means I'm gonna have to go back to the drawing board. Okay. Do it one more time for me. Okay. Move on to the other hand. Alright, go ahead. Squeeze. Okay. Same questions apply. Do you notice any pain while doing it? No? Okay. Once more. Any better, any worse? No? Okay. Back to the drawing board. Okay, now both hands. Squeeze, squeeze, squeeze. Okay, one more time. Perfect, okay. Again, same questions. Any pain? No? Okay. Any better or worse? Of course. No, I'm not disappointed in you. You're doing everything right. I'm disappointed in me. I should know better. This formula's really grinding my gears. Alright. I can take that back from you. Oh, I know it's so fun to play with, but playtime is over. Little guinea pig. Thank you. Unfortunately, this is coming back to the office with me. Alright, now for the next and final test of tonight, and then I'll get out of your hair. Oh, try not to miss me too much. Alrighty, time for some fun. Good. Now these are nice and cold. I put them in the freezer before coming over here. I'm just going to test your sensitivity, if you don't mind. So you're just going to tell me if you feel it as I put it around certain spots, okay? Perfect. It's not going to hurt. Just might be a little kind of a weakening. Sorry for doing it so late at night. You ready? Still doing all right? No pain, no blurry vision, no headache. Good. Alrighty. Let's begin. Alrighty. Now hold still. Can you feel it over here? Good. What about along this cheek? Good. Okay. What about along your chin? Good. Okay. Let's see your forehead. Nice and cold. Good. Positive sign. Don't notice any irritation while it happens. Okay, what about along this side? Good. Okay. This cheek. Good. Alright. What about along your neck? Good. What about along this side of your neck? Good. Perfect. That's all positive. Let me write this down, and then I'll get packed up and out of your hair. Oh, was it nice and cooling? Did you want me to do it again? Just teasing. Maybe next time, though. These are quite fun. Okay. Sensitivity was good. Filled it on all spots. I guess that's all I need from you, little guinea pig. Sorry to cut our time so short. Oh, you wish it were longer? That's very sweet. But little guinea pigs have school in the morning, and they need to get up nice and early, ready to learn. So I will get out of your hair. And for next time, I'll keep what you said in mind. Who wants to spend more time with me, not less? It's very sweet. Now remember, if you notice anything strange happening in the middle of the night, feel free to give me a call. I'll probably be up quite a long time, insomnia. And if something terrible happens, like you can't breathe anymore, don't call me, call an ambulance. And don't tell them what you took. Okay? That remains our little secret. Hopefully. But I doubt anything bad's going to happen, seeing as you're fine and it's been quite some time. Still, remember, Mum is the word. Alright, so shall I see myself out, little guinea pig? Are you gonna walk this nice doctor to your door? Yes, I'm calling myself nice, don't you think? Come on, it was one tiny prick. My goodness. Why, thank you. Is it this way? Of course it is. I've been here before, silly little guinea pig. I just want to spend a bit more time with you. Good night.